The question was whether we are still testing in Mbagathi. The answer is yes, but who are we testing? After we have opened up, we have left Mbagathi specifically for the sick. Initially, we had separated Mbagathi to have both the suspects and the sick. At the moment, we have only identified Mbagathi now specifically only for the confirmed cases. And as Waziri said last week, the counties have been equipped with systems how they can sort out the patients within the county. We only want to leave Mbagathi for the very sick, and that's why we have stopped the process of triaging within Mbagathi, because we don't want to expose most people, especially who are coming suspects. We are still doing some testing at Kenyatta, next to a clinic called Clinic 66, but we are still also preferring to test the symptomatic. We don't want the numbers, we don't want people to come to the hospital. The ones who are in the county, we are having a county process. We want the ones in the hospital to be left only for the sick, because when we mix the healthy or the symptomatic and asymptomatic, the exposure becomes more, and that's why we have changed that system, Waziri. About the charges, when you are picked from the county, we are still charging 1,000, but we had put a program for hoteliers. That's what we were charging, the charges we said.
I think, Mark, to be fair to Mark, the question has not really been responded to. I think the correct position is this. When we pick people, particularly when we are doing targeted testing, we don't charge anything. All right. When we are doing surveillances and when we are doing those kind of situations, when we go around doing mass testing and mass testing identified as targeted mass testing, we do not charge anything. However, as Daktari is correctly saying, we are not doing testing for everybody. You know, we don't just go to the streets and start testing around. We test because there is some reason why that area, you know, should be focused and tested. As Dr. Amoth explained, I think it was last week, testing is very expensive. And we don't just for the sake of testing as a government. There are private labs that are testing, and we have urged them that 5,000 shillings is way too much money, you know, to test, to charge people on testing. So the truth of the matter is that we are not charging ourselves. 1,000 shillings is when people go to those government hospitals and present themselves, not because they have been identified as sick, but because for whatever reason they feel that they should be tested. But the government hospitals, we are not charging anything like 5,000 shillings. That is not us. I would like to ask Dr. Kuria to respond to some of the testing issues.